For trans and gender diverse Australians, accessing healthcare can be confronting. Issues with long wait times and expense plague the system, particularly for those living in regional areas. In 2019, 2 new clinics opened in Victoria. Participants say they're reducing barriers to life-saving care.
For Sage Akuri, looking back at childhood photos has special significance.
It just reminds me of like the last kind of moment where I was able to be shirtless without worrying.
Sage was 10.
I didn't live up to their standard of what a young girl is.
3 years ago, at age 26, Sage wanted to undergo gender affirmation using hormones and surgery. But back then, the decision wasn't theirs alone. To undergo hormone therapy, a mental health professional had to diagnose gender dysphoria.
You've got this person in power in front of you who is sitting there saying, I get to decide whether or not you have this treatment.
4 years ago, updated medical guidelines gave clients more autonomy over the decision to undergo hormone therapy. And at the end of 2019, the state government funded the first trans and gender diverse clinics outside of the hospital system to increase access to trans healthcare in Victoria.
So we are able to see clients within weeks rather than within years.
Jeremy Wiggins' own experience has driven him to change the process.
I felt like I had to prove something in order to gain access to something that I considered to be life-saving treatment.
The clinic model is based on informed consent, where the decision to start gender-affirming hormones is made between a GP and a client.
We wanted to get rid of this notion of gatekeeping where people felt they had to prove themselves.
Endocrinologist Elle Cheung is a leader in trans research. She recently studied the informed consent model in action at another clinic in Melbourne. Of 309 people seeking gender-affirming hormone therapy, only 8% needed further mental health assessment. The second state-funded clinic is in Ballarat, making it the first of its kind in a regional area. Elle Void is a peer navigator and the first point of contact for many of the clients. She explains what services are available from the point of view of someone who's been through it.
My experience living in a regional area was there was quite a lot of bullying. What happens to other people who can't get out of those areas? How do people who don't have the access to leave a regional area, how do they get support?
From the moment the clinics opened in Preston and here in Ballarat, it was clear how much the service was needed. In its first year of operation, more than 500 people came through the doors, including 111 clients in Ballarat. Based on its success, it's hoped there'll soon be more centres like this across regional Victoria.
To have a trans and gender diverse clinic within that service means so much to those people. It means that they can see that there is a space for them that has been created within regional town.
Sarah Jane Bell, ABC News, Ballarat.
And if this story has raised any issues for you, you can contact Rainbow Door on 1800 729 367 or QLife on 1800 184 527 or the Suicide Callback Service on 1300 659 467.